A Missoula hospital is pointing proudly at its new unit to give critical care to babies born prematurely or with health problems. But their competitors across town are raising questions, saying it could be difficult for two units to split that business. Augusta McDonald joins me live now in the studio with more on this story. Augusta?
Yeah. Thank you, Dennis. The new NICU offers level 2 services, which hospital staff say will be able to offer care for most of the babies that are born there in need of more advanced care. St. Pat's opened their family medical center in August of 2015 and have delivered more than 1,200 babies there since. Of those, 30 needed to be transported to Community Medical Center for NICU care. This means at-risk mothers have to spend time separated from their new baby. The new unit will begin operating on March 11th with freshly trained staff and a newly recruited neonatologist who is overseeing the NICU. Deborah Reed Thurston says the unit will allow their family maternity center to expand its capabilities.
Unfortunately, babies are delivered that the whole pregnancy may be totally normal and then something happened and them needing some support after birth. And without having a NICU here, having the available staff is kind of limited.
Over at Community Medical Center, where they've dominated the market for maternity and neonatal care for years, concern sparked over the past few months as plans for the St. Pat's NICU began to roll out. Hospital executives say that the competition may force them to eliminate their level 3 NICU that provides regional care to the most vulnerable infants. The director of CMC's NICU, Bonnie Stevens, said in a statement this week that having multiple neonatal intensive care units can actually reduce the level of care for patients due to the low volume of patients in western Montana that are served at CMC. She says in other specialties like cardiac or orthopedic surgery, competition can improve care due to the high number of patients. But in a low volume, highly specialized field such as neonatal intensive care, she says it's more difficult for neonatal physicians, nurses, and respiratory therapists to maintain their skills. Having two hospitals providing NICU services will reduce the capabilities of the providers at both facilities. The quality and safety of neonatal care in western Montana will decrease, Stevens says. St. Pat's staff say they are not sure at this point how many babies might end up in their NICU this year. Their OBGYNs can still refer at-risk mothers over to CMC during their pregnancy or for delivery. Back to you.
Interesting. Well, we'll keep track of that story and see how that all
we'll be
starts
following
out.
this as it continues.
All right. Thank you very much, Augusta. Appreciate it. A man who found himself trapped under